what's up? We just covered a topic, the first topic in pharmacology. That was pharmacokinetics. With that pharmacokinetics, we talked about the pharmacodynamics also. Now, we're going to talk about the permeation. So, what's permeation? Let's get into that. So, we're in the pharmacology series, and now we're on the topic permeation. So, what's permeation? Let's use the red pen. Permeation. So what's basically the permeation? Permeation is nothing but it's all about the ability of the drug to move effectively in the body. Suppose this is your body, right? So this is your body. Now you take a drug. Now you take a drug, right? You take a drug. Now the drug has to move into the body effectively to show its action, right? So it's all about permeation. Is all about how effectively the drug moves into the body. That's permeation. So let me write in words how drug, or let me write in another word, ability of the drug to move effectively in the body. Do you get it? So, if it's the ability of a drug to move effectively in the body, so what are the things that's going to affect the permeation? So, the factors can be lipid solubility. Lipid solubility. Almost every kind of drug, let's say 80% of drugs are made lipid soluble so that they can traverse through the membrane. So when they're lipid soluble, they get solubilized with the lipid bilayers of the membrane. If there's a cell membrane, it has to pass through the cell membrane, and it'll pass through the cell membrane only if it's lipid soluble. So almost all drugs are made lipid soluble so that they can get into the cell membrane, into the cell. So lipid solubility, the more a drug is lipid soluble, the more it has the permeation capacity. Now the next thing that can affect the ability of the drug to move effectively in the body is the concentration gradient. Concentration gradient. I think I'm saying everything is clear over here. So what is concentration gradient? Concentration gradient is, suppose, let me make that blood vessel with red one. Suppose this is your blood vessel, right? So, and here is your cell. And there's in between there is interstitium or something like that. So, if let me write another. So if this is a drug, then the more the concentration of the drug is in the plasma, the more easily the drug gets diffused in the cell. This is the effect of concentration gradient in the permeation, the ability of the drug to move across the body. Right? So the more concentration of the drug is in the plasma, the more effectively the drug moves into the cell, just like that. Now, so these are two important high yield points that are going to be tested in the assembly. Now, the next important, but not as much important as this point, but still we're going to talk about that, and it's in the vascularity, right, and surface area. The more vascular a certain organ is, the more permeation of the drug that we can see in that organ. For example, suppose, let me erase these things. Suppose this is your muscle. This is your muscle. Now you give IM injection, right? You give IM injection now, and here is your, this is dermal epidermal junction, and here is your epidermis, and here is your dermis with hair shafts and hair follicles and everything, and here is your blood vessels, right? So basically this is dermal epidermal junction, and here up here you have epidermis, and down you have dermis. So now you give injection. You give injection to this patient, right? So this is injection. You give injection to the patient, and now it has to diffuse through this dermis into the blood vessels, right? Suppose here is your blood vessel. So here's your blood vessel. It has to come all the way from here, to here in the blood vessel. So what I'm going to say is the muscle is so much vascular. There's so much vessels in the muscle, but there's not as many vessels as there is in the muscles. What I'm going to say is there's not as many vessels in the dermis or subcutaneous tissues as we have in the blood vessel, muscles. So the drug can easily permeate through the muscles than through the subcutaneous tissues, because it has less vascularity and it has more vascularity. The muscles have more vascularity. So the drug can get permeated. The drug is able to move effectively through the route of IM injection, but not as much from this subcut route, right? So the more vascularity, the more easily the drug is able to move effectively in the body. Now, what is surface area? So what is the interesting thing about surface area is the more surface area we have, the more easily the drug can get permeated through the body. For example, if you take a drug per oral, then what happens is it has to move from the mouth and through the esophagus to the stomach and into the small intestine, right? So the stomach comparatively have less area, surface area, than the small intestine. So the small intestine can absorb more amount of the drug when some amount of drug is taken, right? So because the small intestine has a large surface area, and the stomach has comparatively less area than the small intestine, so the drug can move, but not as effectively as in the small intestine. So the drug can permeate easily to the small intestine, right? So this is the thing. So the four important factors that's gonna help in permeation of the drug is the lipid solubility. The more lipid soluble the drug is, the more easily the drug can permeate through the body, or simply the drug can easily permeate or move through the body. And concentration gradient. The more the concentration gradient of a drug, the more easily the drug can move effectively in the body. And the more vascularity of the organ is, the drug can effectively move across the body. And the more surface area of absorption for the drug can easily be able to permeate or move through the body. So this is the thing that I wanted to convey in this video. So we'll meet in the next video. Thank you guys.